So we had a detailed discussion about the biology and of the surface ablation. Here we are going to talk a little more clinical. So for many years, this surgical technique has been in shadow, and it is only in recent few years that it has come and taken a spotlight. Previously, wrapped under shadows, this eye procedure had limited applications. We as surgeons would limit it to patients having suspicious scans, patients with form fruste keratoconus, thin corneas, and patients with weaker biomechanics. And we as doctors would be scared to opt for this surgical options for obvious reasons. The patient had most post-operative pain and discomfort. The epithelial healing would be slow. The patient would have slow recovery. There was higher chances of infection, more chances of regression, and of course, corneal haze. But gone are those days. We have a better understanding of the technology now. And we understand that surface ablation has wider application. It gives us a more biomechanically stable cornea and definitely has lesser chances of ectasia. So hello everyone, a very good afternoon. And at the outset, I would like to thank Dr. Rohit Shetty sir and Team Narayan Netralaya for giving me this opportunity to talk. So what is advanced surface ablation and how it is different from the conventional PRKs? So it's a combination, a collective term for transepithelial PRK with smart pulse technology. What is smart pulse technology? It's flying spot excimer laser, which basically gives enhanced short-term outcome. That is, it gives a wow effect. And how does it do it? It does it by reducing the residual corneal roughness and increasing the smoothness of the residual corneal bed. Fortunately, I had the privilege of using both the platforms, that is the Streamlight as well as Trans PRK. So today I'm here to share my experience on the Schwind platform. And how is Schwind different from the other technologies is that, like we were just discussing, that it creates a aspheric wavefront guided ablation profile, which definitely has better spherical ablation profile and hence lesser haze. And like sir was just mentioning, that it has an advanced epithelial profiling. So we can fit in epithelium from the center to the periphery. It is increasing like it is anatomically present. And the beauty is that it gives us an equal diameter of the epithelium and the refractive part, which is corrected. So there's no island formation, and hence the healing of the epithelium is far much better and gives us better outcomes. So coming to the disadvantages and how the new technology has catered this and given us more confidence to opt. So coming to the first thing, that is a post-operative pain and discomfort. And why does it happen? It happens because the corneal nerves are exposed and injured. We know that there's inflammation, and because of which there's neurogenic inflammation causing pain. And for obvious reasons, the tear films is more unstable. And how this new technology has catered this thing is the flying spot scanning laser system. So how is it designed that the spot size is very less and there are sufficient gaps in between each spot. Hence this reduces the inflammation, and the neurogenic inflammation, which causes more amount of pain, is reduced. And of course our understanding has been much better now. We know that the using of cold BSS and cold banded contact lens helps us to reduce the thermal energy induced inflammation. Coming to the second point, that is a delayed reepithelialization. This usually happens because of the mechanical damage that we cause with the two-step, either the alcohol or the mechanical debridement or the PTK and the PRK. And of course, because of the inflammatory mediators which are released. And how this new technology has overcome that is that the smart surf technology, it basically creates a smooth corneal bed which has lesser corneal roughness, and hence the epithelium is healed very quickly as compared to the previous conventional PRKs. And of course, now we are using better lubricants. We are using better biological cleansing, lubricating eye drops, which has helped us to give us better outcomes. Coming to the most dreaded complication, that is a corneal haze. Earlier, of course, with the broad beam excimer laser, and when we were not using mitomycin and steroids, the haze incidence was as high as 92% back then. But now, because of the scanning laser and the wavefront technology, the haze is reduced as low as less than 2.1%. And of course, with the use of good lubricants, good steroid, and the use of mitomycin. So when we have catered all these points, so why not give our patients the benefit of surface ablation and not just limit it to only suspicious cornea or where we think that flap would not be the ideal option. So I cannot stress the importance of the fact before ending that a good patient selection goes a long way. Low myopes, low to moderate myopia, patients with lesser astigmatism and mild dry eye do very good with surface ablation as compared to hyperopes, as compared to high ablation, or as compared to patients with chronic allergies, chronic contact lens user where the chances of inflammation is more. Thank you.
Lovely talk, Dr. Aarti.